Today, we're going to tell you a little bit about HDRN Canada and the data that is accessible through us. And then I'm going to do that part. And then Raquel's going to tell us a little bit about multi-regional research in Canada and about HDRN Canada's data services. And then Jamie's going to finish us up with getting started, how you can get started with our data services. So just introducing HDRN Canada. So you can go to the next slide. So we are a distributed pan-Canadian network focused on enabling multi-regional studies. And we support publicly funded researchers, government and not-for-profit organizations, and industry. Next slide, please. Our membership includes the 2 pan-Canadian data centers, so that's CIHI and StatCan, as well as 10 provincial data centers, and we have 2 provinces that have emerging data centers. That's the Yukon and Northwest Territories, and we're working on our relationship with Nunavut. So essentially, we have the whole country covered, including the 2 pan-Canadian centers. Next slide, please. So in addition to all of the work which you're going to hear about today in terms of our facilitating multi-regional studies, we also want to just emphasize that we have a strong commitment as an organization to equity and inclusion. And this is basically happens through a few different teams that we have. We have an idea team, and they have developed an idea strategy, and we have a whole work plan going to support how to apply the idea principles both in our organizations, but also in support of research studies. We also have an Indigenous data lead, and we are committed to supporting and respecting Indigenous data sovereignty. So we have, again, a whole work program around Indigenous data sovereignty, both internal to the organization as well as engaging external parties. And then finally, we have a public engagement team and a public advisory council. And in this way, we engage communities in understanding data use and in giving us advice and guidance on data use. Next slide, please. So all of our member sites operate some version of a trusted research environment, and in doing so, they apply strong privacy protections following the 5 safes. We all have approval processes that ensure the ethical and secure use of the data. And we are also committed to the concept of data stewardship and trying to make sure that data is both being privacy protected, but also ensuring that it is able to be used for the good of improving health and health equity. Next, I'm going to tell you a little bit about the data that is accessible through HDRN Canada. Next slide, please. So we have something called the data asset inventory. We also have an algorithms inventory. These are both available on our website. This slide is a tool that we call the Data Explorer. This version that you're seeing here is the current version, which is being modernized. Our data asset inventory and this data explorer are both being significantly improved at the moment and should be available on our website in September. But just to give you a sense of how we can help you discover our data, we have it organized by the data category or data domain. And then over the top, you can see each of the data centers, whether they be provincial data centers or the 2 pan-Canadian centers. you can see by the color coding whether they have that type of data and whether they have it for the whole population or for something less than 95% of the population, et cetera. And so you can get at a snapshot a fairly good sense of who has what data. I personally use this tool quite a bit in my sort of conversations with researchers and others. And so we think it's a great tool, and the version that's coming out in September is really going to be a much improved version. So look forward to that. The next slide gives you a sneak preview of the way that the new tool will organize the data. So essentially the domains are shown here. And it's important to also note that all of our sites have whole population data that can be used to study people over the life course. So that really is HDRN Canada's unique strength, is that our members all hold whole population data. And so we, through, the network as a whole, we really can, in theory, cover all or most of Canada. In addition, we do also, many of our projects involve what we call project-specific data linkage or external data linkage. Essentially, what this means is a researcher could bring data into one of our data centers to be linked with data holdings that are already in the data center. So we also do that kind of project, and happy to entertain, those ideas as well.
Okay, so now that you've seen the breadth of data available across our network, I'd like to spend a few minutes talking about what it actually means to conduct multi-regional research in Canada. Next slide. So multi-regional research provides us with some really important opportunities. It allows us to study larger, more diverse populations, compare health systems across regions, improve our generalizability of findings, study rare diseases and things that occur randomly or rarely, in the population, and look at regional variation in healthcare and health outcomes. So ultimately, multi-regional research gives us stronger evidence to support better decisions. Next slide. However, the challenge is that healthcare in Canada is managed provincially and territorially. So that means that the data that are generated in each region generally stay within their provincial or territorial borders. And they are subject to different governance processes, ethics requirements, data access procedures, and technical environments. And we know that navigating all of those differences can be one of the biggest barriers to getting a multi-regional project started. So that's where HDRN Canada comes in. Next slide. Another concept that is important to understand is distributed analysis. So this is a class of methods that allow us to do really great science across regions without actually moving the data. So as I said before, line level data generally remain within each province or territory, and we don't bring all those data together into a national database. Instead, our participating data centers are able to prepare comparable data sets, which can then be analyzed using standard analytic code run locally in secure research environments, and only approved summary outputs are actually shared with a coordinating node. And this allows researchers to conduct robust multi-regional analysis while respecting privacy, governance requirements, and local data stewardship. Next slide. However, this only works well if we're comparing the same things across our different regions. So data harmonization is the process of understanding how the data are collected at each site, identifying equivalent variables and transforming them into a common structure where appropriate, and then validating that the harmonized data accurately represent the original source data. So this is one of the more technically challenging aspects of multi-regional research, and the level of support that you will need for your project does vary from project to project, and we're here to help you with this. Next slide. So with that background, I'd like to introduce HDRN Canada's new data services. New slide. So many of you on the call might have heard about HDRN Canada's DASH service for the Data Access Support Hub for academic researchers. You might have heard of CanAsk, our service for knowledge users, not-for-profit, and government. And what we're launching now is one integrated service model that brings all of our capabilities together into a single coordinated offering. And so rather than asking you to figure out which service you need, we've got one front door that you come into. And from there, we work with you to understand your project and connect you with the right expertise across our network. Next slide. So this means we are now officially providing services to 3 broad client groups. First, publicly funded researchers. Second, government and not-for-profit organizations that are using data to inform their programs, policy, and evaluation. And third, industry partners using the results of analysis for innovation that are working on projects that meet HDRN Canada's governance requirements. And although these clients all have different needs, they all benefit from a coordinated national approach to accessing and working with population-level health data. Next slide. So regardless of who we're working with, protecting privacy and maintaining public trust are foundations of everything that we do. And at HDRN Canada, we use the 5 safes framework to ensure that we are protecting the privacy and maintaining public trust. But we've augmented the 5 safes framework to add additional safeguards on top of the baseline safeguards that we use for all projects when looking at private sector projects specifically. And the most important thing to take away from this slide is that private sector organizations don't receive direct access to the underlying health data, but rather the analysis is conducted within approved secure research environments by our trusted and authorized staff. Next slide. Okay, so what does this look like in practice? Our service flows through 4 broad phases. So when you come in our front door, we assess your project. We work with you to understand your research question, to determine its feasibility, to identify appropriate data sources across the network, estimate timelines, and develop a cost estimate or budget. Then, once funding or contracting is in place, we mobilize the project by coordinating and guiding you through approvals, agreements, ethics, and data access across our participating regions. Then we come to conduct. So this is where we support the actual conducting of the study and data access, as the case may be, whether it's for a researcher or whether our staff are accessing the data on behalf of our private sector or knowledge user clients. We support you with scientific expertise, and where appropriate, we can support data harmonization and analytic services. And then finally, we deliver the agreed outputs, whether that's prepared data sets for you to analyze yourself, summary analyses, reports, or other knowledge products, depending on your project need. Okay, next slide. So every project receives a core set of services. This means that when you come into us, we will help you scope your project, assess feasibility, provide you with a cost estimate, and coordinate all of these activities across participating sites, as well as provide you with scientific guidance as you develop your study. At the same time, we know that everyone's needs are different, and some projects need additional support in different areas. So for example, if your project requires extensive preparation of approvals and agreement materials, or if we are able to prepare those approvals on behalf of you, we can do so for a fee, as well as we can help with more complex multi-site coordination, including bringing in linked data like Anne was talking about earlier. We can provide analytic services, and all of those activities can be scoped into your grant or project budget as appropriate. So the important thing to take away from this slide is you don't need to decide all of this before contacting us. If you contact us early, we can talk through your project needs together during that feasibility stage, and we can recommend the level of support that is appropriate to meet your needs. So again, that's why we're encouraging you to contact us early, and that way we can make sure any required services are included in your grant application or project budget. Next slide. So speaking of contacting us early, I'm going to hand things over to Jamie, and she's going to let you know how to get started with us and what are the things that we can do for you when you get in touch.
Thanks, Raquel. Hi, everyone. I'm Jamie. My role at HDRN Canada is helping to operationalize and support these services. So I'll speak to you today about the services that we have available. And these services, they can vary depending on what stage you are in within your project. So different stages, we have different services. The first one I'll mention is our pre-grant application support. So this is a free feasibility assessment, cost estimate, and letters of support to help strengthen your grant application. So if you're ready to apply to a grant, we offer a service that can help you support that. And what this looks like is starting with consultation. So this is where we learn a bit more about your project. We can bring in some of our experts across our network. So depending on where you're looking for data and people with different expertise. And we can also bring in some data experts that can help us all understand your project. Then we would assess the data that you would need, the feasibility of your project, and the estimated cost that would be required for the services that you need. And once this has been determined, you will receive a feasibility assessment, a cost estimate, and a letter of support if needed to help support your pre-grant application. Next slide, please. So here we provided a few of the grant opportunities that are upcoming this fall. These are CIHR grant opportunities. And you can see that some of the scopes are different for different kind of research scopes. So we've provided a link in the chat where you can go and explore some of these more and see what might fit the research that you're looking at or would want to do. And again, if you're interested in some of these upcoming grants, you can come to us and we can help support you in that application process. Next slide. We also offer a free one-on-one advice consultation for researchers with our data scientists. This is called office hours. And this is to help you design your multi-regional project. So during this session, you can discuss your research objectives, your study designs and data requirements, as well as data availability and methods. And you can also talk about specific data for your proposed studies. So during this session, you'll get that one-on-one talk with a data expert. And this is really great for kind of the early stages of your project when you're trying to tease out some of these aspects. You can request one of these office hours and we'll accommodate you with that. And although this is sort of a service for early stages in the research planning, if you're further along and you have a project developed and you come to us with that, the office hours might not be the right service, but we still have these data experts that can help you out in later stages of your project. Next slide, please. We also have a wide range of tools that are publicly available on our website. So these can help you at any stages of your project. Some of these things we've talked about already, like our data assets and algorithms inventories. So places where you can look and see what kind of data is hosted across our network. Also distributed analysis resources we've mentioned. There's some more information on our website. And also other tools and resources like privacy legislation, ethics, study design, inclusion and diversity, equity, and more. So if you want to check out these resources on our website, these are free and publicly available for everybody. Next slide. So ultimately, you might be asking, what do you do? Where can you find the right resources? And in the chat, we provided a link where you can submit kind of where you are in your project and we can help guide you to the right service for you. So whether that's planning your project and you want those office hours or kind of that first consultation to talk about your project, we have that available. We have the pre-grant application if you're looking to apply to a grant. And if you're ready to start a project, we're there to help you as well. We also have our resources online. And of course, if you have any questions, you are more than welcome to email us and we will help you find where we can help you best.